Well, it's that time of year again, flu season. But this time around, the flu is reaching epidemic levels and hospitals are struggling to keep up with the demand for flu vaccinations. So joining us today is Dr. William Shaffner from the Vanderbilt University School of Medicine to discuss the flu, pneumonia, and why the flu is so bad and how hospitals are coping. So, Dr. Shaffner, how are we doing this flu season?
Well, we've had a moderate outbreak of influenza across the United States this year. In some parts of the country it's abating, but in other parts of the country it's still going strong, and it will be with us through February and into March. So hospitals around the country are coping with influenza. It's been a moderately severe year.
So how can we tell when we have the flu or pneumonia, and what are the main differences?
Well, that's an important question because pneumonia is the most common complication of influenza and will frequently bring people to the hospital and put them into the intensive care unit. So flu and pneumonia begin kind of the same way, with fever and cough. But if that cough becomes productive, if you start coughing something up, if you get shortness of breath or you have chest pain, time to see a healthcare provider because you might be developing pneumonia.
So doctor, how can we avoid picking up either of those?
Well, the best way we can avoid getting these illnesses is through vaccination. Of course, we should all get vaccinated against influenza each year if we're older than 6 months of age. That's what the CDC says. And many of us should also be protected with the pneumonia shot that prevents pneumococcal infections. And that's older adults, people who are younger than age 65 who have underlying illnesses such as diabetes, heart disease, lung disease, or if you're immunocompromised. Ask your healthcare provider about getting vaccinated against pneumonia also.
Now, what should be the first steps to treating it?
Well, if you get sick, of course, quickly get some treatment because we have antivirals that can treat influenza and antibiotics, of course, that help us get over pneumonia. But the best way is to try to prevent these illnesses. Let's get vaccinated against influenza each and every year and ask your provider about pneumococcal infections. Get that pneumonia shot if you're eligible.
And finally, Dr. Shaffner, where should our viewers go to get more information?
Your healthcare provider, pharmacists can help you get more information, and cdc.gov is a good source of information about vaccines if you're an adult or a child.
Well, as we all know, the flu is a huge issue this year, so thanks for joining us to help shed some light on it.
Well, very good to be with you.